So good morning, everyone. Thank you for joining us today at the LWA Advanced Pre-Conference. My name is Nicole Villa, and I am part of the LWA San Diego support team in the Office of Strategy and Innovation. Today, I'll be presenting some information about the LWA San Diego sectors and how you can get involved. So first, I'd like to tell you just a little bit about the LWA San Diego vision as it relates to the sectors. As you heard in the LWA San Diego overview earlier this morning, LWA San Diego was adopted in 2010 and is the County of San Diego's vision for a region that is building better health, living safely, and thriving. It aligns the efforts of individuals, organizations, and government to help all San Diego County residents live well. And it's a comprehensive, innovative, and regional vision that combines the efforts of partners inside and outside county government to help all residents be healthy, safe, and thriving. So an example of this was during the pandemic when it was clear that we needed a strategy to keep residents healthy. So the county was able to leverage the building blocks of this vision to sustainably build a population-focused response throughout the county. So the existing structure of the LWA San Diego vision and the vast network of partners really lent itself to immediate activation for education and outreach related to the COVID-19 pandemic. The four LWA San Diego partner sectors on the left, so cities and government, business and media, community and faith-based organizations, schools and education, those existed before COVID-19. At the start of the pandemic, these sectors convened with stakeholders to discuss how to respond to the pandemic. But very quickly, it was evident that there were different sectors that needed to be created. So the sector model expanded to include additional sectors and subsectors to meet the very specific COVID-19 related needs of the community. And you can see those additional sectors listed on the right side of the screen. Okay, so here on the left side, you'll see the county's new general management system. The county reimagined this operational approach to planning and decision-making somewhat recently. And at the core of the reimagined GMS is community engagement. So based on the principle that all that we do should be created in partnership with the people we serve. And then the outer ring is included to reflect the core values of everything we do. So integrity, equity, access, belonging, excellence, and sustainability. So why are we showing this? Because very similar to the GMS, the sectors have a cycle of activities. In line with the GMS, the activities of the sectors also keep communities at the center. Community engagement is really what drives the sector model. The LWA San Diego sectors conduct strategic planning at regular intervals to determine sector objectives and goals. And then they also regularly evaluate their activities by gathering stakeholder input, which we'll talk a little bit more about later. And there's also continuous collaboration among the various sectors, including resource sharing and partnerships on various initiatives. So this process ensures that the sectors are continuously evolving to meet the needs of the community. Now, I've talked a lot about sectors, but what do they look like and what does that mean? So this is the model for the sector teams. Each team has a sector lead, and then some also have a co-lead, and these individuals are subject matter experts in that area. And additionally, there's then a medical subject matter expert. It's usually a medical doctor, and that's the person that's also available to answer medical questions related to the sector. The team also works collaboratively with the medical subject matter experts in public health services to address medical questions and concerns brought through the various sector activities. And then sector support staff support the overall communications and operations of the sector. And this interdepartmental collaboration is really key for sustaining this model beyond COVID and demonstrates the agency and the county's investment in building better health of residents. Now, these are the universal communication strategies across sectors. So they have regularly scheduled telebriefings using the Zoom platform. Some sectors host them weekly, probably not so often anymore, but a lot of them were weekly now. Some of them are monthly, some are quarterly. And telebriefings are really a two-way communication platform. Even though we're presenting a lot of information, there is opportunity for attendees to engage as well through asking questions in the chat, which can be answered live. And then we also have e-newsletters that are regularly sent out to our ever-growing listserv. These consist of timely updates and information on key things that are going on in the community. They also include resources and events that are going on. And then there are sector-specific web pages on the county's website, and I'll go into more details about that later. And then the sectors also maintain and update sector-specific frequently asked questions. And maintaining a sector-specific email account is another strategy, and that's a place where stakeholders can then submit questions or ask or give specific feedback about the sector. And sectors also conduct community presentations upon request, so it could include guest speaking appearances on other sectors or external sources such as radio and TV interviews as necessary. So these are some of the key ways in which partners can get involved in our sectors. You can join our telebriefings, sign up for the e-newsletters, view our website, or email us with questions or feedback. This is an overview of the metrics for the sectors. This is beginning in March 2020 when the pandemic began and going all the way to this summer, August 2022. So we've sustained the telebriefings throughout and adapted the frequency to stakeholder preferences. So that's why some of them are now monthly or quarterly rather than weekly. But we continue to send e-newsletters and network with our stakeholders. It's another way that we collaborate and engage. And so all of this demonstrates the ways that we regularly engage with sectors and how we ensure continuous communication is happening. And all of this is done in conjunction with the sector-specific projects and activities. So a little bit more information about the telebriefings and the e-newsletters. The e-newsletters are really full of resources, updates, and community events. You can see here a snapshot of the business sector e-newsletter. They include public health updates, so that will include things on COVID-19, monkeypox, flu, RSV, and each newsletter is really tailored to the audience. So for example, the business one will highlight business resources or tools for employers, economic opportunities, or events for the business community. And telebriefings, so those are hosted by the sector lead. They're usually about an hour, and they're done with the subject matter expert or the medical expert who is there with that sector lead to be able to answer questions that are asked live during the telebriefing. Usually they feature a guest presentation as well that has to do with a topic that stakeholders are interested in. So it could be, again, something about businesses or for education, something maybe about mental health for students and something that stakeholders from that group can really take back to their schools and districts. So all of these sectors have really done a tremendous job in all the work that they're doing for the communities they serve, including providing tailored communication that addresses guidance or just tools specific to these communities. And the success of this framework and the sector model really led to the decision to sustain the sector model after the COVID-19 response. So as we transition out of the COVID-19 response, this framework will be integrated into the county strategy moving forward. So here on this slide, you can see the different sectors listed again, and you can see how they're going to be integrated into departments within the Health and Human Services Agency. So the top four are the Live Well San Diego sectors that are integrated into our team, and the other ones are going into teams where it makes the most sense for them to be housed. So all of the sectors will really continue to evolve beyond COVID-19 into recovery and to increase accessibility and equity in service delivery for all residents. They'll continue to be collaborative in nature by sharing resources, information, and updates that can be tailored for each individual sector as relevant. And the sector framework is part of a wider county effort to connect and collaborate with the San Diego community to respond effectively to needs and provide tailored information and useful resources to help residents and organizations be healthy, safe, and thriving. Now I'm going to give a little update on each of the four sectors in our Live Well San Diego team. So this is a snapshot of the business sector, which supports businesses and chambers of commerce by convening and collaborating with stakeholders to provide stakeholder-invested resources and programs. In addition to things like the telebriefings and e-newsletters, they offered a certificate program for businesses that focused on employee safety, and now they're currently focusing on binational business support. And then this is a snapshot of the community faith and rural sector, which supports collaboration between community-based organizations, faith-based organizations, and rural partners for greater collective impact. Similar to the business sector, they also held a certificate program. It was focused on the well-being of employees at community-based organizations. And then the rural work group was also recently reconvened and is focusing on emergency preparedness with experts from the community. And then our education sector supports K-12 schools and institutions of higher education by convening groups of school partners to identify pressing topics in school communities and collaborate on activities that support those needs. They partner very frequently with the San Diego County Office of Education on telebriefing content, special presentations, and tools such as the COVID-19 decision tree for quarantine and isolation. And they're currently working closely with public health services to focus on ventilation resources for schools. And then finally, our youth sector employs and engages youth between the ages of 16 and 24 by providing training and professional development, cultivating the future of the county workforce and young leaders. So the youth leadership team program pairs youth leaders with mentors in the county so they can learn more about possible careers in local government. And then the Live Well San Diego Equity Ambassador program, which we also call LEAP, it employs content creators to develop materials about topics that are important to youth that will be disseminated across the region. So a really important part of the sector model is the evaluation component. In order to evolve to meet the needs of the community, the sectors routinely collect feedback from stakeholders. So this is a snapshot of the schedule and the evaluation plan month by month. And then after feedback is collected, it's reviewed and then changes are made. So we adapt to the feedback. So for example, e-newsletter metrics and feedback might impact the format or the content or even the frequency of the e-newsletters. And then similarly, feedback on topics of interest from the group will impact telebriefing presentations. So some of the essential components of the county's population health response include leveraging existing partnerships and integrating at-risk populations from the outset. These were all identified as best practices. So by leveraging internal and external partnerships, collaboration was bolstered and new partnerships were developed. This led to the development of helpful tools, programs, and processes that effectively address community needs. And ensuring two-way communication and that the community has a voice in programs and services is another best practice, as well as providing various avenues for stakeholders to engage in sector work. So how can you get connected? You can join our telebriefings, sign up for listservs to receive our e-newsletters, or you can visit our web pages, which I'll go over briefly now. So this content is available on our current website, but we're really excited about how these pages are coming together on our new website and wanted to give you a sneak peek. So this is our sector team landing page, or kind of the home page. So these 4 buttons, they'll take you to the sector specific pages and resources, which I'll show in a moment. Further down, we have a calendar of our sector telebriefings, so you can see when each one is occurring. And then on the left, there's a short poll to see which community sector you're participating in. And then below that, you're also able to sign up for our e-newsletters. So now we'll get into the sector pages. So this is one of them. This is our business sector website. We have a welcome message from the lead at the top with some information on the telebriefings and past telebriefing materials to show. And then on the next slide, we have a section on the e-newsletters. So there's a link to submit resources or announcements that you would like us to share. And then below that are the resources and contact information with the e-newsletter sign up. So then going into these resources, this is what that page looks like. There are 3 separate resource pages for the business sector. There's employer, employee, and funding opportunities. So here's a sneak peek at the employer resources page, specifically on wellness at work. And again, remember that each sector has their own website, and this is all available to you on our current website at livewellsd.org/sectors. All right, so with that, that is all I have for you today. Thank you so much for joining to learn a little bit more about the Live Well San Diego sectors, and we hope that you will get involved. Thank you.